James Braddock is used to spending a lot of time at the doctor's office.
I have chronic heart failure. I have chronic lung failure. I have bladder cancer.
But thanks to Lee Health's remote patient monitoring program, he's now better able to manage his chronic conditions from home.
It helps me keep track of things.
Patients get a kit delivered to their home. They use it to collect biometric data daily, like blood pressure, oxygen level, and weight. The data goes into a tablet and then is sent to the care team.
There are usually subtle changes that we could pick up with changes in these numbers that help us intervene at a much earlier phase in your disease.
Hi, Mr. Braddock.
If there is an issue, a healthcare provider will join the patient for a video call.
Do you have any swelling in your feet? Do you have swelling in your belly? And then she'll ask me a bunch of medical questions. And then she'll say, okay, she says, I'll get with a doctor here, and then I will call you back and let you know what you should do. And then usually within another 15 minutes, she'll call me with the doctor's recommendations.
The data will go into my chart, so it can be viewed by all the patient's doctors.
The goal is really, number one, to keep you safe in your home. Number two, to allow management of your condition in the home.
Using technology to help people live a healthier life. For Lee Health, I'm Devin Turk.